presenting concerns that I most frequently work with or kind of specialize in are people who have really struggled for a long time with what I would call sort of chronic emotional dysregulation. So that might be long-term depression or long-term anxiety, or even things like relationship sort of stress, people who've maybe struggled to feel connected in relationships with other people. Integrative, kind of broadly, meaning that in terms of theoretical background, I draw from a couple of different forms of therapy. When I think about therapies kind of all together and the range of therapies that are out there, many of them fall along this spectrum between kind of really behaviorally focused, like, okay, here's what you're doing that is, maybe problematic or causing distress. Let's change that. To, on the other side, maybe not talking as much about behaviors that are happening right now and more about, okay, let's kind of dig into your past. Let's build insight into your patterns and sort of why you are the way you are. I find myself somewhere in the middle. So I do some work with people to help change behaviors, but I also really think it's important to look at our patterns over time to build insight into ourselves. Non-judgment, and this can take a lot of different forms. Can certainly be non-judgment of others in their lives, but I would say most frequently I talk to people about the way that they talk to themselves, maybe that really harsh critic, and I try to work with clients to first just be aware of that voice. Talk a lot with clients about awareness, how change, a lot of people come to therapy looking for change, and of course that's something that we're going to aim for, but also just how far awareness goes, that ability to even catch yourself maybe beating yourself up or being really critical of yourself. I get really excited by watching clients change internally, being a witness to their change. And maybe it is that they're talking to themselves really differently, or more aware of themselves and maybe their emotions, or making sense of their feelings in a different way, or finding that they relate to people differently than they did before. Maybe they feel more connected, for example, to people around them. Starting therapy is it's a big choice, and I recognize that, especially for a lot of people. It may feel like a big risk even, opening up to somebody that they don't know well can be really challenging, especially when you're sharing some of the hardest parts of your life with that person. Really, certainly I believe in the power of therapy to help people, but I also think it's so important to really take your time to find a setting that you feel comfortable in, a therapist that you connect with. A big part of what works in therapy is that relationship with your therapist and feeling like they really understand you.